Experts estimate nearly 22 million Americans over the age of 12 suffer from substance dependence or abuse, either drugs, alcohol, or both. Those figures, however, do not even begin to address the influence drug and alcohol abuse exerts on the lives of others.
Prior to coming to Synergy, I had an addiction to opiates and alcohol. It was pretty severe. Alcohol, just couldn't go without a drink. Depression was severe, just didn't want to get out of bed anymore. It was awful. Life just didn't seem to hold any value anymore.
The alcohol countered the effects of 49-year-old Scott D's antidepressant medication.
I found Synergy through my therapist at the time. She spent the weekend researching outpatient clinics for me. She came upon Synergy and then called my wife. They researched it together. My wife came down, was very impressed with the whole Synergy operation, the way it was run, and the people.
The family physician-owned and operated rehab center located in Palm Beach Gardens, Florida, provides treatment programs for patients like Scott suffering from addiction.
Let's face it, nobody sets out to become addicted to drugs or alcohol. It may start by being at a party, experimenting with an illegal drug to be part of the crowd. Maybe somebody who has a back injury and they start taking prescription pain pills, and little by little they start taking a little more, a little too often. Regardless of how it starts, nobody expects to become an addict, and certainly nobody is prepared for the misery that goes along with the disease of addiction.
Addiction doesn't only affect just the addict, but the entire family. As a family, we've been touched by the disease of addiction for over 20 years. We came to the conclusion that the traditional modalities of treatment really were not fulfilling the needs of the addict or their families. Our programs are based on the blending of the dynamics of life experiences we've had with our professional academic training.
Experiences Wolpert says no family should have to face, but ones which are giving his family the ability to now help others.
At Synergy, we can offer very unique treatment solutions for the addict as well as an excellent support system for the family. It's a family approach for a family problem.
The approach begins with a complete history and psychological evaluation to identify a potential dual diagnosis.
A dual diagnosis simply means that in addition to the diagnosis of substance abuse or eating disorder, that there is a psychiatric condition or a psychosocial condition coexisting, like depression or anxiety or bipolar disorder. It becomes important because unless that coexisting condition is treated thoroughly, no one can fully move through their steps of recovery.
The foundation of treatment is built upon a multimodality approach.
Traditional therapies have failed us to this point because they are, in essence, too concrete for each individual. We can't fit each individual into one treatment protocol. What makes us different at Synergy is the ability to individualize our programs to each person who comes to us, regardless of their problem, so that we will combine the proper treatment modality for the proper needs of each individual client to achieve treatment success.
Individual and group therapy, family therapy, acupuncture, nutritional education, massage therapy, and personal training sessions are all part of the treatment.
At Synergy, we utilize traditional, alternative, and holistic therapies to create a multidimensional approach to treating the client's problems. And the reason for this is because the disease of addiction is multidimensional. In order for clients to feel better and to get well, they need to feel better physically, emotionally, and spiritually.
An environment, Scott says, helped him to feel comfortable while seeking treatment at the center.
Synergy has helped me where I didn't think anybody else could help me. Although I still have a lifetime of issues to work out, Synergy has gotten me out of bed and on the right path to recovery.